Every heartbeat makes the LUB and DUB sound. LUB is the sound of the tricuspid and mitral valve closing, while DUB is the sound of the aortic and pulmonic valve closing. Heart failure is when the heart muscles and valves get weakened. The balloon there is demonstrating what a heart in failure will look like. When a balloon fills up with too much air, it will eventually pop. Similarly, a heart in failure, when it gets too much blood in it, it will eventually fail. This is the failure of the LUB and DUB. My name is Tanish Kaladindi.
I'm Emily Chung.
I'm Alicia Daria.
And I'm Ashish Prince. Heart failure, commonly referred to as HF, is a condition where the heart cannot meet the body's requirements for oxygenated blood. Heart failure presents itself in many forms, with the most common being left-sided heart failure, which occurs when the left ventricle can no longer pump a sufficient amount of blood to the rest of the body. There are two types of left-sided heart failure, systolic heart failure and diastolic heart failure, also known as heart failure with reduced ejection fraction and heart failure with preserved ejection fraction, respectively. Systolic heart failure occurs when the left ventricle cannot contract effectively and cannot properly distribute adequate blood flow to the rest of the body. Conversely, diastolic heart failure occurs when the left ventricle is stiff and cannot relax properly between beats, thus fills to less volume than a healthy heart, causing it to beat at a rapid rate to make up for the loss. In both cases, blood begins to build up in the lungs and the rest of the body, which is also known as congestive heart failure. Although left-sided heart failure accounts for the majority of HF cases worldwide, right-sided heart failure is an equally important concern. There are two main types of right-sided heart failure, biventricular and isolated right-sided. Biventricular heart failure occurs when there has been failure in the left ventricle that has affected the right ventricle's ability to pump. Conversely, isolated right-sided heart failure occurs when there is failure in the right ventricle, however the left ventricle remains unchanged. Isolated right-sided heart failure mainly occurs due to chronic lung disease, which makes it difficult for blood to obtain oxygen in the lungs and increases blood pressure in the pulmonary artery, making it difficult for the right ventricle to pump into the lungs. Furthermore, heart failure can be classified as either acute or chronic, with acute being used to define conditions that develop rapidly that are caused mainly by an abnormality within the heart, while chronic is used to define a condition that has developed over long periods of time that often occur due to lifestyle and genetics. Now my colleague Emily will go into depth into the pathophysiology of heart failure as well as go into potential causes.
Thank you, Ashish. Pathophysiology of heart failure pertains to sodium and potassium intake. When there is an increase in sodium, the body will begin to retain water, which leads to an increase in blood volume, thus also causing high blood pressure. This increase in blood pressure leads to right-sided heart failure, as the right side of the heart will have to work harder in order to pump blood to the lungs while also facing the challenges of the narrow blood vessel walls. An increase in potassium causes an arrhythmia to occur due to an interference with the heart's conduction system. These both cause heart failure as the heart will become weakened from having to pump at a quicker rate. Heart failure is very complex as there are many potential causes. According to Dr. Gary Francis's research, 30% of patients with heart failure have developed the disease due to genetic abnormalities that cause them to be more prone to structural abnormalities. For example, aortic valve stenosis. Aortic valve stenosis is when the aortic valve becomes narrow and is unable to let sufficient blood flow from the left ventricle to the aorta. Aortic valve regurgitation is when the aortic valve does not close properly, therefore the blood from the aorta leaks back into the left ventricle. Both of these cause heart failure as it will cause thickening of the left ventricle due to the backflow of blood. When the left ventricle becomes thickened, it is unable to hold nor pump as much blood. Other complications include atrial septal defect and ventricular septal defect. This is a hole located either between the atria or ventricles of the heart that become larger as blood flows. As the hole becomes larger, the oxygenated blood will begin to move back into the lungs instead of the body, which therefore decreases oxygen output and causes the heart to have to work harder in order to compensate for the lack of oxygen being delivered. This would also cause right-sided heart failure as the right side of the heart will become weaker from the added pressure. Finally, other complications include pericardium abnormalities as well as conduction abnormalities that are seen in the poster. This leads to heart failure as the heart would be unable to hold as much blood due to the lack of diastole occurring, yet it still has the responsibility to pump sufficient amounts of blood to the body, therefore leading to the overworking of the heart. Now my colleague Alicia will discuss the diagnosis and treatment of HF.
Thank you, Emily. Reviewing a patient's medical history and recognizing possible risk factors such as consistent coughing, hypertension, and loss of appetite can help a physician know if any physical examinations need to be done. Though there are many tests that can be done, the most frequently used ones include chest x-rays, which help identify any other causes as to why there would be fluid buildup in the lungs and/or shortness of breath. Another test is an echocardiogram, which gives the patient's ejection fraction as well as more vital information. A physician can monitor a patient every 3 to 6 months, as well as see the cause as to why they might be having heart failure. Another commonly used test is a blood test, more specifically a BNP test, which stands for brain natriuretic peptide. It is a blood test that measures levels of BNP, and it is made by the heart and the blood vessels. BNP levels greater than 100 picograms per milliliter has a 90% predictive value. Depending on the type of heart failure and symptoms that are being presented, a physician can diagnose a patient with multiple medications and 3 groups of drugs. Typically, a diuretic is used first, such as furosemide, which helps treat edema that is caused by heart failure. Then, if needed, it's followed by an ACE inhibitor, which blocks substances in the body, causing the blood vessels to tighten as well as relax, lowering the blood pressure and increasing the supply of oxygenated blood to the heart. If neither is seen to be effective, a beta blocker such as metoprolol is used, affecting the response of neural impulses in the heart, causing the blood pressure to decrease as well as the heart rate to slow down. Therapy used to treat heart failure is not as common as it is today. Pacemakers are used in cardiac resynchronization therapy, which allows the heartbeat to go to a normal pace. Gene therapy is another type that is believed to be a great hope for conditions like heart failure. It may be able to take a normal gene and place it in a human cell to change how the cell works and potentially even treat heart failure. Living a heart-healthy lifestyle is essential, such as physical exercise, which will help the patient maintain a healthy body weight as well as lower their blood pressure. Now my colleague Ashish will go into depth about what we can do after diagnosing.
Over 50% of HF patients are readmitted within 6 months, showing immense lapses within heart failure education. According to the European Journal of Heart Failure, less than 20% of patients after their diagnosis received education regarding identifying warning signs of heart failure such as hypertension and were unaware of the effect that previous heart attacks and other conditions had on heart health. Furthermore, over 40% of patients receive no education regarding proper at-home self-care from their physician. Research suggests that education is vital in the prevention of heart failure and that proper physician instruction is imperative in order to obtain optimal results for patients. Additionally, patient noncompliance poses an additionally large issue. According to a study with over 100 patients, researchers found that although 80% of patients knew that they needed to lower their sodium intake, less than 1/3 actually did it. Furthermore, only 25% of patients understood the risks of alcohol, and 36% believed that they should consume more fluids, both of which are detrimental to heart health. Furthermore, only 76% of patients complied with physician instructions and took prescribed medications daily. Although proper physician instructions are necessary, patient noncompliance poses an additionally large issue that must be overcome. So now my colleague Tanish will discuss what we can do to prevent these readmissions.
Thank you, Ashish. It's very important to try to prevent heart failure from developing in the first place. One way to prevent it is by eating a heart-healthy diet. A diet you can try is the DASH diet, which stands for the Dietary Approaches to Stop Hypertension. The DASH diet is a diet high in potassium, calcium, and magnesium, and it's low in added sugars, saturated fats, and sodium. There are 2 versions of the DASH diet. One restricts sodium intake to 2,300 milligrams, while the other restricts it to 1,500 milligrams of sodium. The one that restricts sodium intake to 1,500 milligrams, if people were to eat 1,500 milligrams of sodium, blood pressure would decrease by 25%, and it would save the healthcare system $26 billion. On top of that, it would save between 0.5 million to 1.2 million lives in the next 10 years. Another diet is the Mediterranean diet, which includes beans, nuts, and whole grains. The Mediterranean diet is the only diet to prevent Alzheimer's. Another way to prevent heart failure is physical exercise. The CDC recommends 150 minutes of moderate intensity physical exercise and 2 days of muscle strengthening activities. Only 20% of adults meet these requirements, and if they did, they would reduce high cholesterol and it would also reduce blood pressure. Another thing that's important is to avoid unhealthy habits such as smoking and drinking, as 20% of cardiovascular deaths are directly related to smoking, and 780,000 people die each year from cardiovascular diseases because of too much alcohol. We can prevent all these by taking a proactive lifestyle, so we must act now.
Our solution is an app where you can connect any Bluetooth device. The app will be able to read the patient's ECG as well as heart rate and determine if it is normal. If there are any abnormalities, the app will directly send a voice message to the patient's POA or PCP that is located on the patient information page. On the patient information page, you can find the patient's vital information as well as any of their medical physicians. The next page is a symptom list page where the patient can click any of their symptoms and get more information regarding lifestyle changes that they can help prevent further complications from arising. If the patient were to have any questions, they can ask a certified doctor that is on call who will reply in 1 to 2 minutes. Lastly, our app has a Get Support page where the patient can join any heart failure support group directly from our app. This is what makes our app different from anything else. We have everything all in one place. This is especially helpful for the elderly as they do not have to be confused with all the different types of apps. Rather, we have a one-stop shop for them. Thank you so much for listening, and we hope we are able to help prevent the failure of the LUB and DUB.